One of the first problems that we have in the sector related to what we are engaging about today is the issue of rape culture in our institutions of higher learning. Rape culture is pervasive in our institutions of higher learning. Just last year at SAUS, we recorded about 23 cases of students who were raped in various universities, without giving you an example of each. But we also, on top of that, have got unreported cases where students get scared to report. That if I report that the registrar of a university raped me, I might be deregistered with immediate effect. But there are also other reasons why students do not report cases when they are raped in campuses. But I will deal with that later on. But the rape culture is one of the main problems that we have in the universities. And you know, part of what arises is that you are exposing many young people to danger of being infected because of such. The second problem is the various abuses, sexual harassment, and all those incidents. And I'm sure you know what has been reported in media recently about some of the lecturers who abuse students, incidents of sex for marks. That for you to pass, if you want me to make you to pass as a lecturer, I must have sex with you. So it's one of the problems that we have of abuse by lecturers on our students. But even recently, to make it worse, young female academics are also complaining of being abused by their bosses in these universities. Just recently, I'm sure you saw a petition that was submitted to Minister Pando by academics complaining about incidents of sexual harassment and abuse. So it's another problem that we have in our institutions of higher learning. Just one of the recent examples that happened this year, still fresh, a student who was gang raped by more than 5 men at the University of Van, the Univan, this year. So these are some of the problems that we face as students in our university. The other problem that we face is the issue of entrenchment of patriarchy, masculinity, and the culture of violence. Now it's a problem that is growing in our universities. And I tell you, it's growing because of incidents that we're experiencing in our universities. Not only bullyism, but also even cases of murder being reported. You know, at DUT last year, Dr. Ramnik, a female student was shot dead by a boyfriend. You see, so if a boyfriend is demanding unprotected sex with you and you refuse, and the boyfriend decides to murder you, it's a problem that we have in our institutions of higher learning: patriarchy, masculinity, and violence. If I was speaking for basic education, I was going to say it's even worse also. You see students going to school with knives. There's a case now that was just in public now of a child who stabbed another one. How do they end up with a knife in a campus? It's a problem. The other problem that we have in our universities is the issues of vulnerability, desperation, and decay of societal morals. I think you know that our universities are no longer caring much for students. Someone who comes from deep rural areas is going to be in a big city like Port Elizabeth or Cape Town for the first time, does not have a place to sleep, does not know who to help, does not have any relative, and is desperate and is vulnerable. There are people who take advantage of that vulnerability and abuse our students. It's one of the problems that we have. But the issue of moral decay, you know about it. But I always say the behavior of a student in campus determines where that student comes from, the society with which that student grew under, because it takes a village to raise a child. So those things come to campus, and when you read the newspaper that an 80-year-old granny was raped, or you hear that a 4-year-old baby was raped in a society. And a child who grow up in that environment, arrive in campus, the behavior is likely not to change unless a lot of work is done. So one of the problems that we are facing, you heard that even pastors who are supposed to teach us morals are raping the children as well. Now, it's a problem where students do not know where to run to. You know about the phenomenon of blessers, which was dominating, and our universities, that phenomenon is very prone. And because of the challenges, socio-economic issues that our students face, these blessers arrive and take advantage of our students. And in the process, it leads to the spread of this pandemic. So, the issue of time is a problem here. I was just told at the time, but let me try to be fast. I wanted to tell you about cultural barriers, where if a student wants to go and seek medical circumcision, is looked down upon by other students who say you should go to the mountains and so on. But those cultural barriers in our university, you start to see them manifesting. Not to forget the issue of alcohol abuse. It's a very big problem. The alcohol outlets, they see a market when they see students, not knowing that they are destroying these young kids. You know, statistics were provided by Dr. Ramnik here, that 60% of students in the TVET sector are reported to be abusing alcohol, and 35% of all the students, and so on. So that is the problem, the picture of the problem. I would go on and on. Let me go to the second aspect, very quick. The impact, the consequences. So as a result of all this problem, there is a problem, number one, of stigmatization. You see it even in our residencies. If a culture in a university is toxic to that extent, stigmatization arises. In a residence, for example, Dr. Ramnik, if I am using ARVs and my roommate find out that I'm using ARVs, will tell everyone in campus that this roommate of mine is using ARVs, and in the process, a student start to be looked down upon. So how do you deal with the residence policy allocation to ensure that there is privacy and the student is able to be helped? Now, discrimination of the LGBTQI community, I think it's an issue that you have raised, and you discussed also the issue of discrimination of students with a disability in our institutions of higher learning. And teenage pregnancies, it's in our institutions of higher learning and unplanned, 24% of young people and students are part of that group. You know, we have pregnancies that are unplanned pregnancy. Suicide in our universities is growing at an alarming rate. When I was coming here to this conference, I just got a call that at the University of Fort Hare just yesterday, a student committed suicide. You see, there are many cases, you know, at Rhodes University, there's a student who was raped and reported the case, and the university did not do anything and decided to commit suicide. And many other cases of suicide and also femicide. It also, the other result is poor academic performance, dropout rates growing because of this. Because in an environment where you are discriminated and there is stigmatization, you choose rather, I must stay at home, and you end up dropping out because you are hopeless. So let me propose what I think must happen. Then we'll discuss. I will not say my proposals are correct, but that's my thinking. That we must have a clear sexual harassment and GBV policies in our universities and colleges. It will assist to deal with these issues, because most of the universities I know, they do not have policies that deals with the GBV. And I think, Dr. Ramnik, we must have a youth and student rights charter to deal with issues of human rights and so on and so on. Strategic partnerships and programs that creates awareness. It's very important that we have such with the partnership between government, civil society, and our institutions. And I think the issue of strengthening of safety and security in our institutions, it's a must, because students cannot continue to lose lives in our institutions of higher learning due to GBV and sexual violence and all those issues. And I think we need to support the feminist movements that are in our campuses, and all these champions of anti-GBV movements. We need to give them support because they are pushing a genuine struggle because of these problems that I have mentioned. So if we are not supporting them, they will not be able to. And I think we must also have a clear student mental health program that will target students and also the youth, so that there is free counseling, there are psychologists that are available, so that our students get help, so that suicide can be prevented if we have a mental health program that is clear and that is there. And wraparound support, I think I'm passionate about that. We need to do that, you know, so that we support our students not to be vulnerable and be exposed to all these dangers. And I think we must also have a student health insurance to guarantee treatment for students who are living with HIV. I think we need to have a student health insurance. It's possible. We can push that and be united and ensure that we have that targeting TB and all that. And I think in terms of innovation, I think we need to take advantage of the mobile smartphone technologies for information dissemination. It's difficult for a student because of the stigma in our campuses to even go and read a notice that this notice is talking about where should I go for counseling and all that. So if you have information on the phone, it will be more easy without being seen reading a notice by other students. Thank you very much.